Bariban, and I will continue with discussions of the clinical chemistry or some topic that they are interesting in clinical chemistry. So the first topic is about the ketone bodies, but we wanted to know what is the metabolism and what are the reasons for the formation of the ketone bodies. Here you can see what are the causes of the ketone bodies, why the body have to form the ketone bodies. So the first reason is there is a decrease in the glucose, in the glucose level in the blood. So this is the first reason and the main reasons. The other reasons is prolonged starvation. The prolonged starvation that leads also to decrease the level of the glucose. That is indirect cause to causes to decrease the level of the glucose. And here is also diabetes mellitus uncontrolled type 1, which is known as diabetes mellitus ketoacidosis, and from its name you can see that is lead to the formation of the ketone bodies, but we will discuss later how diabetes ketoacidosis lead to the formation of the ketone bodies. And also it's thin diet, if there is a reduced amount of the diet and restricted carbohydrate, all these are around there is a decreased level of the blood glucose, and that is lead to the formation of the ketone bodies. What are the organs that they are affected when the ketone bodies formation in our body? There are two main organs, the brain and the muscles. The main organ that occur in the ketogenesis is the liver. One important point to know it is that the liver is the main organ that is responsible for the ketogenesis. And what is that means? That means that the liver is responsible for the formation of the ketone bodies, but it's nothing to do with the liver. The liver cannot be use these ketone bodies. There is no use in the liver of the ketone bodies. Three organs use these ketone bodies, which they are brain, muscles, and also the renal cortex of a kidney. So these are the organs that they are affected by the formation of the ketone bodies. Okay, so let's go to our points. The first thing is the first source of energy in our bodies. What is the first source of energy? So we can say that is a glucose to the pyruvate, and then the pyruvate to the acetyl coenzyme A, and then the acetyl coenzyme A with the oxaloacetate, they form something which is called the citrate, and the citrate go to the Krebs cycle, and this Krebs cycle lead to the formation of there's many things that this can be happen: electron transport, NADH and FADH, and that is lead to the production of ATP. This is the normal and the first source of energy. Again, glucose transformed to the pyruvate to the acetyl coenzyme A, combined with the oxaloacetate, and then the citrate, and then enter the Krebs cycle, and that is leading to the formation of ATP. But when there is a reduced amount of the glucose, then that is lead to the reduced amount of the pyruvate, then that is lead to the reduced amount of the acetyl coenzyme A, and the citrate also reduced, and that is lead to the reduced ATP, and that is continua and continua and the continua till our bodies turns to another source of energy, which is free fatty acid. So we have the free fatty acid, then the beta oxidation of the free fatty acid, which we can say it's a breakdown of the free fatty acid, and again that is lead to the formation of acetyl coenzyme A and lead to the production of ATP. Now we understand why is decreased glucose level in the blood that is lead to the formation, or that is lead to turns to another source of energy, which is the use of the free fatty acid. But now we want to know what these are ketone bodies. But again, so if the first source of energy, which is carbohydrate, is not enough, the body will switch to break down all the free fatty acids. So we have the free fatty acid by the beta oxidations that is lead to the formation of acetyl coenzyme A, citrate, NADH, FADH, and lead to the production of ATP. But the body can use another mechanism to synthesize glucose. Maybe can use the oxaloacetate to produce the glucose, but that's with the time that is lead to the reduce the amount of the oxaloacetate and the citrate, because you can see here that there is also oxaloacetate. If there is acetyl coenzyme A, then it needs to the oxaloacetate and formation of energy. But with prolonged starvation, then this is source of energy is also depleted. So how the ketone bodies they formed here? So we have two parts of the acetyl coenzyme A. I mean acetyl coenzyme A and acetyl coenzyme A. So we need two acetyl coenzyme A. Okay, and then after the acetyl coenzyme A, and by the enzyme is called acetyl coenzyme A acyl transferase, which is known as a thiolase, and that is lead to the formation of acetyl coenzyme A. So again, we have two molecules of the acetyl coenzyme A. By the enzyme, we can say thiolase, or we can say acetyl coenzyme A acyl transferase, and that is lead to the formation of the acetyl coenzyme A. And then by the acetyl coenzyme A, then there is a it should be enter the reaction, which is another acetyl coenzyme A. So we have now three acetyl coenzyme A, and by the enzyme, which is non HMG CoA synthetase enzyme, which is a rate limiting step, or we can say it's a rate limiting enzyme. So be careful that each reaction or each cycle need a rate limiting enzyme. So we have this enzyme, which is so important to remember it, to memorize it, because it's so important. When I say rate limiting enzyme, that's so important to memorize it. So we have this enzyme, which is known as HMG-CoA synthetase enzyme, and that is called 3-hydroxy 3-methyl glutaryl coenzyme A. So, and that is lead to the productions of HMG coenzyme A, which is 3-hydroxy 3-methyl glutaryl coenzyme A. So again, we formation of the acetyl coenzyme A, and then we add another acetyl coenzyme A. So we have now 3 acetyl coenzyme A to produce something which is known as a 3-hydroxy 3-methyl glutaryl coenzyme A, and sure, the enzyme, it will be by synthesis of these productions, okay, so which is known as 3-hydroxy 3-methyl glutaryl coenzyme A. So, and then the reaction will continue, and then that is lead to the depletion of the acetyl coenzyme A. So we here add acetyl coenzyme A, and they reduce, this is reduced to the acetyl coenzyme A. So we take a part of acetyl coenzyme A and then reduce it, we'll produce it to the reaction. So like plus minus, there is no nothing happened now. Okay, and by the enzyme now we causes the lyase of these productions, which is mean breaking down of this enzyme, and that is lead to the formation of a by the enzyme of 3-hydroxy 3-methyl glutaryl coenzyme A lyase enzyme, and that is lead to the breakdown of this production and lead to the formation of the acetoacetate, and the acetoacetate is the first ketone body. So we have 3 ketone bodies, and this is the first one. Again, this reaction is so important, so I will repeat it again, which we have through two acetyl coenzyme A, two molecules of the acetyl coenzyme A, and by thiolase enzyme that is lead to the formation of the acetyl coenzyme A, and then we add to this reaction acetyl coenzyme A, and by the helping of the enzyme which is non 3-hydroxy 3-methyl glutaryl coenzyme A synthetase, and that is leading to the production of a 3-hydroxy 3-methyl glutaryl coenzyme A, and we can say this enzyme is a rate limiting enzyme, and that's so important to memorize it again. And then that is lead to the production by this reaction another acetyl coenzyme A, and by the helping of the enzyme which is known as HMG coenzyme A lyase enzyme, and that is lead to the production of the first ketone bodies which is known as acetoacetate. Then I wanted to know what is the fate of the acetoacetate, because by the acetoacetate we can know the other ketone bodies. So acetoacetate maybe go to the blood, and some go to the muscles, and some go to the brain, and some go to the renal cortex. So that's it. And here is a big important information I want to mention, that the acetoacetate is the only ketone bodies that can maybe found in patient, focus to my words, in patients only. There is no ketones in the urine. Okay, no ketones absolutely in the urine, but if there is a ketone in the urine, only one that is can be found in the urine, which is known as the acetoacetate. So that's why I said acetoacetate, some go to the blood, some go to the muscles, some go to the brain, and some go to the renal cortex, I mean here kidney. So acetoacetate, by the helping of the enzyme which is non beta hydroxybutyrate dehydrogenase enzyme, and that is lead to the beta hydroxybutyrate, which is the second ketone bodies. Again, I said there are 3 ketone bodies. Acetoacetate is the first one, and the second one is the beta hydroxybutyrate. Beta hydroxybutyrate. So I will not confusing it, but there is a lot of other information. But first let us discuss all the ketone bodies, and then we discuss all the information. So acetoacetate lead to the formation of the beta hydroxybutyrate, but this enzyme is not known as a beta hydroxybutyrate synthetase, for example. No, it's beta hydroxybutyrate dehydrogenase enzyme, and that is lead to use of the NADH to the NAD positive. And just remember this information, that we use NADH to produce the NAD positive. That's mean that is an important for this reaction. And is the pH of, how we can say, pKa of the beta hydroxybutyrate is 4 to the 5, which is acidic. And here we have the acetoacetate, also by the acetoacetate dehydrogenase enzyme, that is lead to the formation of the acetone and CO2, and that all is happen in the blood, and the acetone is the third ketone bodies. So now we know 3 ketone bodies: acetoacetate, beta hydroxybutyrate, and we have also acetone. And we know that the main one is the acetoacetate by a beta hydroxybutyrate dehydrogenase enzyme, that is lead to the formation of the beta hydroxybutyrate. And also we know that the acetoacetate itself also by the acetoacetate dehydrogenase enzyme. This means that we have to remove this hydrogenase enzyme, hydrogen atom, and that is lead to the acetone and CO2, and the acetone is the third ketone bodies. Let's talk some information about these things. Both acetoacetate and beta hydroxybutyrate are acidic ketone bodies. We say ketoacidosis, so that means they are acids. Their pKa is 4 to 5, so they donate H positive proton inside the bloodstream, and that is lead to the acidosis. So if the acetoacetate and the beta hydroxybutyrate, they are above the level inside the blood, that is lead to something which is non-acidosis. And other information: excessive acetoacetate, excessive beta hydroxybutyrate, that stimulate the area post-derma, and post-derma that is present in medulla oblongata, and that is stimulate the vomiting, and that is lead to the hypovolemia, which reduce the blood pressure, then dehydrated, and that is lead to the comatose state, which that is explain why the diabetes ketoacidosis patient come to us in a young age with a coma status. And also cosmal breathing, that's mean acidosis of breathing, because there is very deep breathing of a rabbit, that's mean cosmal breathing. And then we will discuss also the ketonuria. So inside the muscles, and I said this is muscles, we have the beta hydroxybutyrate. By the beta hydroxybutyrate dehydrogenase, this is the reverse of the action, and that's it important. That's why I said to you focus in this information. So the beta hydroxybutyrate acetoacetate, we learned above that the acetoacetate by the beta hydroxybutyrate dehydrogenase enzyme, but we use NADH to produce NAD positive, then that is lead to the beta hydroxybutyrate. But now the action is reversed, and that is lead to the production of the NADH. And focus on this, because if increasing the NADH, because there is a ratio between the NADH and the NAD positive is increased, that is lead to the lactic acidosis, and that is lead to the acidosis. Okay, let's continue with this reaction. So acetoacetate by the succinyl, or we can say cyclinyl coenzyme A to the cycinate, that is lead to the formation of the acetoacetyl coenzyme A. So we reverse this action by the thiophrase, and that is leading by the acetoacetyl coenzyme A transferase by using of coenzyme A, that is lead to the production of the acetyl coenzyme A, and these are using a Krebs cycle, and that is leading to the formations of ATP. So this is the reverse actions of what is the formations of the ketone bodies. So we can say that the ketone bodies are the source of the energy, but after the glucose depletion or prolonged starvation, can we say. And now I want to explain why the diabetes ketoacidosis, I mean why type 1 causes diabetes ketoacidosis, which is very, very common in type 1 and not common in type 2 of the diabetes mellitus, because we know something, that the insulin inhibit ketosis and inhibit lipolysis. Okay, there is no ketone. If the insulin presence, there is no ketogenesis, there is no lipolysis. But if the insulin absent, and that is happened in a diabetes mellitus type 1, and that is lead to the no insulin, so there is no inhibition of the ketogenesis and lipolysis, there is a reduced level of the glucose, so that is lead to the ketogenesis, and that increasing of the ketogenesis, formation of ketone bodies. And these ketone bodies, that is leaded to acidosis, because we said that the acetoacetate and beta hydroxybutyrate, they are very, very acidic, and the acidosis causes inhibition also of a neurotransmitter, and that is lead to the coma. So we have two mechanisms why the diabetes ketoacidosis lead to the coma. The first one, that is causes stimulate of the post-derma, and that is lead to the vomiting, and that is lead to the hypovolemia and dehydrated, and finally lead to the coma. Or the acidosis also inhibit the neurotransmitter, that's why the patient confused and then come to us with the coma. The other information I said before, that the ketone bodies are not used by the liver. They are synthesized in the liver, but they are not used by the liver. They used by skeletal muscle, brain, and renal cortex. The other thing, acetone, which is the third ketone bodies, is not the source of the energy. Not, absolutely not. But the acetone, it's like a clue. If the patient has acetonic breath, a fruity breath, then we can understand there is something problem with this patient or with this person. And another mechanism that we discuss it, if there is a reverse action of the beta hydroxybutyrate to the acetoacetate, and we use the beta hydroxybutyrate dehydrogenase enzyme, but that is lead to the production of the NADH, because we know that the NADH, or the ratio between the NADH and NAD positive, if it's increasing, that is lead to the lactic acidosis. And the question is why? Why is the more production of the NADH that is lead to the lactic acid production? Because we know that this reaction, pyruvate plus NADH plus H positive, that's mean the use of the NADH, that is lead to the lactate and NAD positive. So we use NADH to turn the pyruvate into lactate, I mean the lactic acid, and that is why that is leading to the formation of the lactic acid. Again, type 1 diabetes mellitus, no insulin, so more ketones. Type 2 diabetes, there is insulin, but the problem in the receptor, so no ketone bodies. And again, we said insulin inhibit the lipolysis and the ketogenesis. The other information you have to know is the RBCs do not produce the ketones body. RBCs do not produce the ketone bodies. The only produce ketone bodies is the liver, and especially in the mitochondria of the hepatocytes. The other thing that the urine ketone tip only detect the acetoacetate. I said before that if there is no ketones, normally there is no ketones in the urine, but if there is a ketone in the urine, then the only ketone body that can be found in the urine is acetoacetate. The other information I want to talk about these things to cover all the things about the ketone bodies, that what is causes of the presence of the ketone in the urine, and put in your mind if there is an increase in the glycogen, which is reversely action with the insulin. So if there is an increase the level of glycogen or cortisol or T3, T4, I mean the thyroid enzymes, or there is a catabolism, that is lead to ketones in the urine. For example, diabetes ketoacidosis, no insulin, that is formation of ketone bodies. Alcoholic patients, because two mechanisms actually, there will be an increased level of acetyl coenzyme A, and of course that is due to the ketone bodies formation, because we understand now that the ketone bodies formed about of two molecules of the acetyl coenzyme A, and the alcoholic patient like forget to eat, like there is a maybe prolonged starvation, and that is lead to the action of glycogen and increasing the level of glycogen, that is leading to the formation of the ketone bodies. The other thing is hyperthyroidism, so increase the level of T3 and T4, and that is lead also to the formations of ketone bodies. Also aspirin, because aspirin lead to decreased level of glucose level, and that is increase the activity of the glycogen. And anesthetic, because it has a catabolic action, and that is leading to the formation of the ketone bodies. So finally I would just remind you that the ketone bodies are three: acetoacetate, beta hydroxybutyrate, and acetone. And that's all about the ketone bodies.